Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I'm Mary Alale Yusuf. Since the start of the AIDS epidemic in the 1980s, 78 million people have been diagnosed with the human immunodeficiency virus, that's HIV. Approximately 35 million people have died from AIDS-related illnesses since it began. Now, 1.1 million people died from AIDS-related illnesses last year. 40,000 of them were children. However, there's been progress, with about 18.2 million people now having access to antiretroviral therapy. Western and Central Africa account for 18% of people living with HIV. My guest is Professor Sulaimon Akomu, a specialist in hematology and blood transfusion in the College of Medicine, University of Lagos, and a consultant hematologist to the Lagos University Teaching Hospital. He has been a member of the National Task Team for HIV/AIDS in Nigeria since 1998 and is currently the chairman of that team. He's also a member of several other bodies related to training, prevention, and treatment of HIV/AIDS. You are welcome to the show, sir.
Thank you.
You're eminently qualified for this. Now, I was listening to the executive director of UNAIDS, Michel Sidibe, and he was saying that the number of new infections in older people, in adults, has not gone down. Why is this?
But that statement may not be 100% correct.
Okay.
The age stratum that is at risk for HIV infection is between 15 and 49 years, okay. What we call the reproductive age group. What we call pediatric AIDS really is essentially a maternal illness that is transferred to the child. And we say that pediatric AIDS today should not occur again if that program is designed to handle it, which we refer to as the prevention of mother-to-child transmission of HIV.
No, but he was talking about adults, especially.
I am now saying that it may not be 100% correct because world over, we now have epidemiological evidence to show that the prevalence in all given population has been declining. For example, in our country, Nigeria, I will tell you that the national, the Federal Ministry of Health has been organizing every 2 years what we call the surveillance for HIV and AIDS every 2 years. Mm-hmm. And of course, the time that we had the highest prevalence in our country was in 2001, when the prevalence of this disease in Nigeria was put at 5.8%. And since then, from 2001 to 2003 to 2005 to 2008 to 2010 and to 2014, we have seen steady decline in the prevalence.
So it is really success.
It's a big success. 5.8% is now at 3.2%.
But that is slow, isn't it?
It is difficult for me to agree that is slow, because the factors that drive the transmission of the disease in our society is a veritable factor. That veritable factor is sex. Okay. To handle the issue of sex is a big thing.
Yeah. Before we go into all that, when they talk about infections in older people or adults, what age are they referring to?
We say HIV rarely affects people age 50 years and above. 50 years and above. Not that we don't see infection in people who are 60, 65, 70, we have seen, but it's very uncommon. This disease is prevalent in the reproductive age group, sexually active age group.
I would have thought, sir, I would have thought that there will be more older people now with the infection, given the fact that there's a lot of antiretroviral therapy now, which is probably making them live longer.
That logic is sound. And that is actually what we want. And that is why we say today, when we are talking about antiretroviral therapy, we should also begin to talk about how are we going to be managing age-related diseases that people living with HIV infection shall be coming up with. So the issues of myocardial diseases, issues of chronic kidney diseases, issue of chronic arterial diseases, as well as likelihood of stroke in individuals living for long with HIV is there.
But correct me if I'm wrong. These are diseases that could happen to anybody because of age.
They are diseases that could happen to anybody because of age, but in those who are HIV infected, what we call immunological complications of HIV makes these diseases to come faster and earlier in this group of people.
Since we're talking about complications here, tell us something about co-infections with AIDS. For example, TB. Of the 1.1 million people who died last year, the statistics say that 30% died from TB related with AIDS.
And that is the albatross of that disease we call HIV and AIDS. What HIV does to the human body is that it infects the most important immune cell.
The T cells.
The helper T cell. That is the typical cell that this virus infect and eliminate. The moment helper T cell level is low, your ability to fight chronic bacterial infections is lost. Your ability to fight other viral infections is lost. Your ability to fight fungal infections is lost. Your ability to fight protozoal infection is lost. And your ability also to prevent what we call mitotic changes that naturally occur in the human cell, converting that human cell to a cancerous cell. You have an ability, you have immunological mechanism to handle it. That immunological mechanism that prevents you from developing what we call malignancies or cancer is also lost. So you are at increased risk of developing not only what we call opportunistic illnesses, we are also at increased risk of developing what we call opportunistic cancers. Top on the list of opportunistic illnesses or infections is the TB.
Okay, and now talking about the tuberculosis, when it affects, those living with HIV and AIDS, doesn't it also compromise the health of those who are not